OCO, we're here in Tahlequah, the capital of the Cherokee Nation, and we've got some important matters to talk about and to ask our health team to help us with. And that is three critical areas. I want to thank the Deputy Chief of the Cherokee Nation for being here. I want to thank members of the Council, including the Speaker of the Council. I want to thank Dr. Jones with the health team and members of the Cabinet and other staff that could join us. The three areas we're going to talk about is telemedicine, dialysis, and Medicare. And how this came about is listening to our council. People know that the Council of the Cherokee Nation does work month in and month out in a formal way, but every day there is an opportunity to learn from our council, listen to our council about issues that they're hearing, issues they're concerned about. That's where these three subject matters come from. I want to particularly thank Councilor Johnny Kidwell, who's down here at the end of the table. There's some of these issues that he raised that he wanted us to look at. Speaker Shambaugh raised some of the others. And as we started to talk, Deputy Chief, with other council members, we heard a common theme. Not criticism, but concern about what kind of opportunities are there out there to do better. When we go to our health team, they're always thinking about how to do better, how to go further. So what we're going to ask in three memoranda that I will sign today is for Dr. Jones and his team to focus more intently on these three areas. And I think the result will be we'll have a more informed elected officials, myself included, so that we can better understand how we can go further in these areas. Telemedicine is something that I think is an opportunity for us to stretch how we reach people in terms of healthcare. Our health team is already a leader in telemedicine, and so if there's opportunities for us to use telemedicine to reach out not only across the reservation, but someday even across the country more than we're able to do now, we want to do it. We know, though, that there are technological barriers, there are legal barriers, there are barriers in terms of administration of these types of programs. We want to better understand how we can maximize, though, telemedicine, not only today, but far into the future. Another issue, and this was particularly brought to us by the Speaker of the Council, is dialysis. Now, we already provide dialysis services to some extent within our health system, and then, of course, we rely on our purchase and referred care program to provide other dialysis opportunities for patients. But there is a concern about access to dialysis, and a number of council members have raised that. So we're going to study that issue. What are we doing now for dialysis? What could we do in the future? What strategies could we employ to improve access to dialysis? Finally, third-party pay sources, health insurance, are important to the Cherokee people. They're important to the health system. One of the areas that there may be opportunities to support Cherokee citizens in the future is in the area of Medicare coverage. It's not only the traditional Medicare plans that many of us know about, but it's other parts to Medicare that could enhance access to health services for our citizens. We've got to study these. We've got to be transparent. That's what these memoranda are about. We've got to be responsive to our council. And Deputy Chief, I think we need to always make sure citizens know that this council isn't just working during the times they may see them on streaming video. They're working every single day. We get phone calls every single day. Dr. Jones is always open and responsive to council members. This is an opportunity to take what we've heard and focus it down to some specific tasks that we'd like our health team to undertake these examinations and get us a report back by July 1st of this year. So, Deputy Chief, I know all of these subjects are of interest to you, and I appreciate all your support on these.
Well, thank you, Chief. And both of us have spent time on council. We remember what it was like being in the field with our citizens. We're still there today, but the council, their work, they've had a listening ear. They've been listening with their heart, and they've brought these three items to us, and it's so important. And myself, I have long worried about our citizens and when it comes to dialysis and so many things. Chief, we've been at-large meetings where we've met individuals that have the credentials that we need here, but they live far away, but they're willing and want to help. Telemedicine may be a part of that, and then understanding Medicare. I mean, that is a giant task. We have a great team of people that help our citizens understand that. What are those other parts? How can they be essential to us? These are three very good things that I think they deserve our attention. Our citizens always deserve our attention, and congratulations to the Tribal Council for being out there and doing their job each and every day. And rest assured, we have the A-team in any department at the Cherokee Nation, and we are prepared to tackle any task.
Well, thank you, Deputy Chief. Before we hear from Dr. Jones, I would like to ask the Speaker of the Council if he could share some comments, and then particularly Councilor Kidwell, who brought some of these issues from a unique perspective, and that is an at-large council member representing a lot of citizens who don't have ready access to our health system. Mr. Speaker, thank you always for your support and bringing some of these issues to our attention.
Well, Chief, I think across the nation, we have the best Indian health facilities possible. I think in Oklahoma, by far, even in the nation, I think we are the best. And I think if we are going to continue to be the best, I think this is exactly what we're going to have to do. We're going to have to listen to our constituents, our citizens, and when they say, hey, this is where we need help, I think it needs to be looked at because, you know, if you're not moving forward, you're moving backwards. And so I think this is a great, great initiative.
Well, amen to that. Thank you, Mr. Speaker. Councilor Kidwell, I know that many of your colleagues share the same interest and concerns that you have expressed, but I want to thank you for bringing some of these issues to our attention and wondered if you'd share some words. I know you have a unique perspective.
I appreciate that, Chief. Thank you very much. You mentioned earlier listening, and this is really what this is about. Not just you listening to us as a council, because these issues aren't exclusive to me as an at-large counselor by any means. We all hear the same things. We all get the same information from the people that we try our hardest to represent. This is about you listening to us and us listening to them. And not only does this show that we're listening, we're putting action behind what we know that our people need and what we know that they expect from us. And that's movement forward on different aspects of virtual health, Medicaid coverage, Medicare coverage, and dialysis. It's extremely important. We know it's important to them. And we're showing them that it's also important to us, Chief, and I appreciate that. I know the whole entire council does. Thank you.
Well, thank you, Councilor. Thanks to all the council members. Deputy Chief, this administration, this council believes in progress, believes in moving forward on health care, believes in transparency, believes in making sure we study issues. The good news is we've got the best health team in the country. I think it's the best anywhere, Indian country or the rest of the healthcare landscape. I think these folks are the best. And the other good news is they already study these issues, that they're already thinking of these issues. All we're doing today is really focusing on three specific issues that we know the council's interested in, we know that you and I are interested in, and when we turn to Dr. Jones for this kind of help, he and his team never fails to say, we will do our level best to examine it and execute for the Cherokee people. Dr. Jones, I can't say enough about your work and your team's work. Any thoughts you would share on these three issues we're talking about, which is to examine telemedicine, opportunities for dialysis access, and opportunities to support our citizens as they access health insurance, particularly Medicare?
Well, thank you, Chief. And the one thing I want to start off by saying is we really appreciate the engagement that we have from the council, from our administration, and the support that we have. It's undying. It's always there, and it's something that we really appreciate. Above all other health systems, we have support from all areas within our administration. So that's number one. These are very complex subjects. We've been studying them for some time. We appreciate the fact that we're going to have the opportunity to not only conclude our studies and learn more about these things, but also to be transparent and convey that information in a way that can be conveyed to the citizens and conveyed to our administration so we can guide our desire to put resources in certain areas to help make progress on these things. So we appreciate the focus and we appreciate the support, and we look forward to the information we're going to be able to bring to you.
Well, thank you, Dr. Jones. So with that, I'll affix my signatures to three memos. One, and the first one will be the memorandum that establishes the telemedicine work group. That's right. All right. We appreciate everybody's interest on that. The second one will be the memorandum to support access to dialysis. I know is important to many Cherokee citizens. I know it's important to our council. And finally, we will sign a memorandum that establishes the work group on supporting access to Medicare, another complicated subject, but we know this team will continue its study and will conclude with a report with some recommendations to go forward. All right, very good.